Hello, I'm Dr. Ronald Gibbs, clinical professor of obstetrics and gynecology at Stanford University School of Medicine. I'm also the Knowles Distinguished Scholar, and it's my pleasure to provide this introduction to RiskyBaby. I am providing this on a completely voluntary basis. I'm especially pleased to be working in collaboration with my dear friend, Dr. Arda Lembet. Dr. Lembet worked with us in the United States when I was at the University of Colorado, and I know firsthand of his incredible knowledge, his exquisite skills, and his compassion in caring for patients. I applaud the efforts Dr. Lembet is making in RiskyBaby to decrease mortality in mothers, newborns, and fetuses, caused as a result of premature birth, other high-risk pregnancy complications, and their consequences. His RiskyBaby program is unique in its global outreach and its scope. My special interest is in infections of the mother, the fetus, and the newborn. And you know that premature birth is associated with an increased risk of infections in newborns and in the fetus, and it's also associated with an increase in infections in the mother. So infections, even whether it's clinically silent or whether it shows by the way of maternal symptoms, is responsible for a large percentage of premature births, especially those that occur very early in the prematurity cycle. We've had some successes in the story of infections, notably the prevention of infection due to the group B streptococcus. This bacteria is a cousin of the group A streptococcus that causes the familiar strep throat. In the United States and in other countries where group B streptococcus is common, one of the great public health victories has been in decreasing neonatal severe infection due to the group B streptococcus by screening for women who have group B streptococci in their lower genital tract and by providing antibiotics in labor. This has been one of the most successful public health programs to date. Well, other causes of premature birth besides infection include bleeding in the uterus and overstretching of the uterus. Overstretching might be a complication of multiple pregnancies, especially triplets or quadruplets. And when a pregnant woman presents in preterm birth, she will present usually in one of three categories: spontaneous premature contractions, premature rupture of the membranes, or with some maternal or fetal reason that she's going into labor, or where premature birth is considered the actual best outcome. So while we understand the mechanisms of premature birth, we know that in many cases there is no cause recognized, and even where the cause is recognized, there may or may not be an effective treatment. So there's plenty of room and, in fact, timely need for new interventions, for education, and for improvement of care. Thus, RiskyBaby is an important and very timely program, and I wish it every success. Thank you.